most famous physical therapist on the internet.
Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet, in our opinion. I am Bob, exactly one half of the Bob and Brad team, and I am going to be the host today. I'm joined by Chris the Pharmacist. It's my great pleasure to have him again. One of the smartest guys I know. I definitely have him in my top 5, that's for sure.
Uh-oh, that's a scary 5.
So today's topic is going to be anxiety medications. We're going to talk about the SSRIs, and we'll explain to you what that is. You know, what do you do? How do you choose one? We're going to go through all that. And he has a plethora of knowledge on this. So you want to start by talking about what the SSRIs are?
Yeah, I mean, basically what an SSRI is, it stands for selective serotonin reuptake inhibitor. So it's kind of a mouthful. So it's definitely kind of hard to process, but there's several drugs in that category. I mean, you can go with, Celexa, which would be citalopram. There's Lexapro, which is escitalopram. There's Zoloft, which is sertraline. There's Prozac, which is fluoxetine, and Paxil is paroxetine. So those are the main ones that are in that family.
The big thing it's trying to do is, the big question I have is, what is it exactly doing? It's improving your serotonin levels?
Yeah, so basically what happens is to understand when we're treating anxiety, basically when we put people on these types of medications, is it's communication between two nerve cells. And so what serotonin does, it kind of carries signal A to signal B. And when we have anxiety, some of those nerves are hyperpolarized and you're not getting real good transmission. And serotonin is kind of looked at as kind of a feel-good or relaxing type of neurotransmitter. And when that message is interrupted or maybe just not sent properly, it's going off into the other areas of the brain, bloodstream, what have you, you're finding that these cells are hypercharged and you're getting things known as anxiety. When we take medications like the aforementioned SSRIs, what it does, it doesn't give your body to make more, but what it does, it blocks the uptake of it. So it's a selective serotonin reuptake inhibitor. So think is blocking. And so it's going to allow more serotonin to kind of bathe that cell gap so that it transmits more of that information to hopefully help you to feel a little bit more calm.
So when you go off the medication eventually, is that going to affect your body's ability to produce the serotonin, or do you know what I mean?
Yeah, it's an interesting question and it's debatable. So basically, it's interesting. I mean, we know for a fact that anxiety is a biochemical driven condition. Is it brought on by life circumstance? Is it brought on by, fear? I mean, there's a lot of mitigating factors that lead to it, and there's different forms of anxiety within that group as well. When a doctor says it's, and you and your doctor are part of this team to determine when it's ready for you to go off of these types of medications, you have that discussion and you'll want to taper off, because if you go off of these medications abruptly, you're going to have some very serious problems. And it's not so much that you're physically addicted to the medication, but you can have, kind of this withdrawal syndrome kind of thing where you kind of go off the medication and you feel yucky. You get rebound anxiety,
can't you get like electrical shocks?
Yeah, they kind of, basically the term that kind of floats around in my circle is brain zaps. So basically when people, they just feel like just little electrical stimulation kind of going through the brain, they can't stay focused, they feel agitated, they don't sleep well, they can be short with their tempers, feel achy. I mean, it's actually it's a multitude of side effects that are associated with it. And even just one of the things that's very important in my arena as well is adherence to the drug. So meaning you have to take it consistently. Drugs don't work if you don't use them consistently. And it's paramount that you take them on a daily basis as your doctor directs.
So let's bring up this question. What if you miss a dose?
Well, that's a very good question, actually, Bob. And so what we do when you miss a dose, we try and tell the patient, it kind of depends on the time of the day that you recognize it. But if it's, kind of use the kind of half a day. So if it's within 12 hours, take it for sure right away when you remember it. If you're getting to, let's say since the next morning and you're like, oh my gosh, I forgot my dose yesterday. No wonder I felt horrible. We don't want you to double up. You just take your normal scheduled dose and get back on track.
And you'll obviously feel maybe a little bit of effects of that. You're going to have the half-life of it, right?
You're going to notice that. And really, with the exception of the drug fluoxetine or Prozac, that's the only one that people can kind of get away with skipping. All the other ones have shorter half-lives, and you know it when you skip a dose. And I mean, all of a sudden, let's say you just take your normal dose at 6 a.m. every morning after you have breakfast. All of a sudden, it's noon, and you're like, I just don't feel right. I can't focus. I'm kind of ornery. And you're like, oh, I forgot my medication.
Sure.
So, and then at that point, it's like,
that probably create some anxiety itself.
Sure, and
Sure.
it can. So, I mean, at that point, we'd instruct you if it's possible. I mean, if you're in the middle of your work day, I don't know if you can just leave work and go back home and
Right.
take your medication, or somebody can bring it to you. But I mean, we want to try and come up with some sort of solution, because it will definitely affect the remainder of your day.
Sure. Now you talked. I mean, a lot of people out there are questioning whether or not they should be on drugs.
Sure.
And they don't want to be, because people like to take drugs if they don't.
Yeah,
have to.
I mean, when we talk
And-
about the stigma,
And you talked about the three things that are important.
yeah. So, with anxiety, I mean, to understand it, I mean, there's, the mainstays of therapy are really, it's going to be either medicine or chemical, and then also therapy. So cognitive behavioral therapy are really the big two. And you're a big proponent of that.
Yeah.
And across the board, when doctors are choosing what's best for the patient is driving the bus in this case, because if somebody's not saying, oh gosh, I don't know that I feel comfortable going to counseling. I don't have the time. I can't leave work. I have
You mentioned the stigma. of
there
it.
sometimes can be
Yeah.
considered a stigma, which is
Hopefully
the absolute
less.
wrong thing.
Yeah.
We have to smash that stigma, because it's not a stigma. I mean,
Right.
you're talking about 50 million people, 1 in 5.
Well, you also mentioned when we were talking about this at one point that you said that you've seen more this year than.
Yeah,
and it's been a stressful year.
2020. Thank goodness this is the
Yeah,
last
it's
day of the
fair.
year.
Kicking it out.
It's one of these things where it has been rough. And as a pharmacist, when I dispense the medications that doctors are prescribing, I've seen a tremendous increase in both the SSRIs and other drugs used for anxiety as well. So it's definitely there. It's definitely prevalent, and again, it's so important to just kind of circle back that the patient kind of drives the bus for the treatment. If you think, well, I can take a tablet every day and it's going to work for me, and you're going to make it work, I think it's important that that's probably your choice. And your doctor will go through a series of questions that are going to determine maybe what's the best choice for you, and ask, would you be amenable to considering counseling, cognitive behavioral therapy?
So yeah, you had mentioned the 5 drugs,
Mhm.
and these are the main 5.
Yep.
Right? Correct. And some of them have been around a lot longer than others.
Sure.
And so they have a long history of them and how they affect people, and
Yep.
and so they can feel comfortable with what you can propose the side effects are.
Absolutely.
So-
Absolutely. And actually, all these drugs now are old. I mean, I've been a pharmacist for over 25 years. These drugs are all well into.
Oh, they are.
Yeah. So they're
So that's
older
really not
medications.
you probably don't need to make a choice based upon that.
No, but it's just kind of from a scientific standpoint, it's kind of interesting that with brain imaging, we're seeing that these drugs, they work. And if you think of a stream, actually, when we take the SSRI drugs as a class, there's a lot of things going on upstream, probably that are much more significant as far as what we're seeing with brain chemistry. And then using the medication certainly helps, but it's kind of more downstream, meaning the things that are probably to come with medicinal science are probably going to be much improved therapies as they learn which enzymatic systems to trigger, or what trigger points that we need to hit. So there's other things going
that'd
on
be
above
great.
stream. So I think
mean, yeah.
I don't want to say it's crude or rudimentary, because they're excellent medications that safely help people to manage anxiety conditions every day. But I think there's things that we can do better. And I think that's the wonderful thing about science, is we're always pushing that envelope. We're always trying to learn. We're always trying to go
Improving.
forward.
It's a miracle what they're able to do now, even if you ask
Yep.
me. I
Oh,
mean,
doctors are very, very adept at helping
Yeah.
patients these days. I mean, it's not even always drugs, like I said. I mean, therapy for some people is a wonderful opportunity.
Now, the side effects, you had mentioned that they are fairly similar among the 5.
Yeah, they really are. And it's kind of interesting. Like, all of the drugs have a different chemical structure, but they act on the same area, which is the serotonin reuptake. And they're just really in that synapse. So from that standpoint, it kind of comes down to the clinician's ability to select something for your needs, maybe your body type. And they might even ask some questions about family members. Hey, do
Right.
you have any family? Because, genetics play a big part in all
Sure.
of the things that we drive, and they do kind of drive the bus. So let's say, your mother, your father, aunt, uncle, brother, sister took something like, hey, that drug worked well. Well, why don't we try, maybe sertraline's going to be the best choice for you, or maybe fluoxetine's the best choice for him, or maybe paroxetine's the best choice for me. It just kind of depends on what your clinician decides. And keeping in mind, these drugs do take time to work, so it's not quick. It's a 4 to 6 week endeavor to start
and
to get
that's the
relief, which is
discouraging
frustrating.
thing, right? Because if you have anxiety, that seems like for a lifetime.
Yeah, I mean, it
And
is a
yeah.
lifetime, because I mean, that's, an
You're
understanding.
counting off the days.
Yep.
And so we understand that, this is something, if you consider it, you probably want to get it started. Because
Yeah, you want to get started. Just even the definition of anxiety is kind of interesting. They want you, most days of the week, you should have a thought that's just not sitting well with you for 6 months. I mean, that's kind of DSM
Yeah,
5
put up
guidelines,
with
and
for
for
6
6 months, I
months
mean,
of
it's like when
anxiety.
you have if you have anxiety, you want
Yeah.
it gone yesterday.
Yes. Yeah.
It is an awful feeling. It's an overwhelming sense of dread, and it's just something that we really don't want to delve into because it's just such an awful, uncomfortable feeling.
Right.
And and until you've been in those shoes, it's really hard to understand that perspective. And again, it's just like, well, I don't know why he feels that way. He seemed just fine yesterday. Well,
Right.
it,
Right.
it doesn't work like that at all.
Yeah, you don't.
And so when you
I can't
tell,
understand it.
and that's the other thing, as a pharmacist, and I'm sure as a doctor, if we had one sitting here too, and you tell a patient, it's going to take about 4 to 6 weeks, Bob, before this is going to help you
Yeah.
feel better. I mean, that you're like, what?
What? Yeah.
And I
exactly.
mean, it's somewhat deflating, but the thing is that we get your body used to it. We minimize the side effects. We
And
keep
you
you
have
on
to ramp
track.
up slowly.
We do
I mean,
ramp
you
up
have to-
slowly. Yeah, because if I give you too much too fast, in
it's
all
gonna
likelihood,
cause
you're going to feel
anxiety
yucky.
too, right?
Well, you can feel yucky. You can have an upset stomach. You can be nauseated. Your appetite can be shot. You don't sleep well. I mean,
Yeah,
so
and then it's going to compound.
so
things.
we start, basically baby steps, and the appropriate dose based on body type, weight, again, genetic factors, what have you, other medications that you take. So your clinician is going to look at a lot of different things that go into the prescribing of the choice
Are the
that they provide
doses
for you.
fairly similar for the 5?
No. I mean, you look. Let's see. We'll pick on citalopram. You got a 10 and 20 and 40 milligram tablet. Sertraline's got a 25, a 50, and 100 milligram tablet. Fluoxetine is a 20 milligram and also a 40 milligram dose. So paroxetine's got the 10 and the 20 and the 40, and then
So the typical where they end up at, those tend to be different.
they do, but it's it's interesting. I mean, these drugs are also used for depression, but for anxiety, you'll see a little bit different dosing level for each of them. Sometimes it's a little bit higher.
For anxiety.
Yeah, it can be. So
Interesting.
yeah, it's kind of funny how that works, and even within the classes themselves, like paroxetine tends to have a little bit higher dose for like OCD, obsessive compulsive
Sure.
disorder, and things
Yeah.
like that, or other types of anxiety. So, and then whether you're using it for social phobia or agoraphobia, I mean, there's other anxiety conditions under that big umbrella
Sure.
too. So it just kind of depends. Your doctor is going to drive the bus on that, and really, what they do is like we were talking about. You start slow and you gradually build up. They're going to ask you. You're going to come back for an appointment in about 4 weeks, and then there's either going to be a phone call or another appointment after that, discussing, how well you're
Well, that
tolerating
brings
it.
up the point. So you have 5 drugs here. What can you see as the difference between, like, let's say the best performing one and the worst performing one for you? Could you have one that does nothing for you?
No, I mean, well, you
Yeah.
can, and that's why these other choices exist. I mean, way back when, with when Prozac came out on the market, I mean, it was just, and then all of a sudden Zoloft was number 2. I mean, it's kind of, I think the drug industry itself, they see something, and Prozac at the time when it came out, I mean, there was a book, Prozac Nation. I mean, there's a lot of things out there that came out when these drugs were first available, and they all, I guess the fondest form of flattery is imitation, right? So they
Sure.
come up with drugs, and they think, well, hey, is the manufacturer of Zoloft, I'm going to one up, the manufacturer of, and that's not necessarily true, but they come up with a way to get into that market, and they do want to constantly improve. And and when you look at the molecules, they all look functionally different. And so let's say we started you on something that didn't work well. We have other options available for you. And so that's why
And
it's,
how soon would you know that?
You're
Would
going
you
to
maybe
know
in a couple weeks.
I would say you're going to have a solid answer probably within 4 weeks. And that's why that first appointment back to the doctor is so critically important. And they're going to ask you those questions. How are you doing today?
So
Bill or
is that
Bob or
common
Jane.
that you might not have any help from is it?
I wouldn't call it common,
Common,
but
but
it can certainly happen. And so that's why it's important to keep that next appointment with your provider, because they have to gauge how well you're performing. I mean, if we're giving you a drug that doesn't work, or you're not buying into the fact that you have to take it every day, we've got some serious issues that, as a pharmacist, we want to make sure that you stay adherent on the medication and that you're tolerating it well and you're not experiencing the side effects that could create problems for you. And so, we always say, please give us a call. We'll try and help you out any way we can. And so oftentimes I spend a lot of phone conversations with patients just saying, well, and we actually, the other thing that we do with the company that I work for is we make what we call adherence calls. So we'll call you in about 5 or 6 days
nice.
to make sure that you're actually doing well and comfortable on the medication.
See, that's what I was wondering, because doctors have a feedback loop.
Yep.
Because they're seeing the patient and they come back, and I wasn't sure if that you had that. So
Yeah,
apparently you do.
yeah, we do,
You
and
have
I
a good
think
sense of what
yeah, and
how these drugs work and what side effects and
exactly, and it really does make a difference, and I think patients really like to hear from us too. It's like, it's just
absolutely.
like, oh, really? Yeah, thanks for calling, and
Sure.
to me, it's very gratifying. It's worthwhile, and if I can even just help somebody an inkling, I feel like it's definitely made a difference, and I'm hoping we can keep things going forward so that they can continue to get the help that they need.
When you're ramping somebody up, now let's say they end up being at 100 milligrams or something like
Sure.
that. They're not going to feel the full effect of that until they're at the 100 and for another 4 weeks after that, right?
It can be because there is a change, and so you get the first 4 weeks where I guess honeymoon period's probably the wrong word, but
You're at 25 to 50 maybe.
yeah, I mean, just if we pick on sertraline, for instance, a lot of times we'll recommend start at 25 milligrams because side effects, GI are most common.
Sure.
So it can cause nausea, it can cause, loose stool, pain. So, I mean, we want to try and avoid that. So we say a little food
But
first.
those will go away.
Those will go away. And
Yeah.
usually within about 5 to 7 days, they're gone.
Okay.
And then at that point, depending on your clinician's wishes, that might be the point where we jump you up a little bit. And then we kind of have you sit there until that 4-week appointment. And then we see how and your doctor will determine how you're tolerating it and if it's beginning to see the benefits. So, in this case, since we're talking about anxiety, it's like, well, are you feeling a little bit more calm, a little bit more relaxed? Are you sleeping a little bit better? Are things a little
Sure.
bit better through your day to day? And hopefully the answer will be yes, I think things are getting better. And then at that point, or if it's, if the answer is no, they're not doing well, I still feel like garbage, but do you feel like you've gained some benefit from? Yeah. Well, then maybe we are going to ramp you up to the next level dose. So instead, let's say we were at 50 milligrams for, 4 weeks. Maybe we're going to try you at 75 or even
Sure.
100 milligrams to see that. And then we're going to re-engage in about a month to see how you're doing at that point.
So how long does someone typically stay on the drug? And if they have the idea they'd like to get off?
Yep, and that's an interesting question, Bob. So there's not a simple answer. When these drugs all first came out, they were thought you just needed to take them for six months and everything was all as well. We've found that over the years that is not the case. I mean, there are people that have been taking it for years.
Sure.
So a lot of it, you get to a point too where sometimes the drug just kind of runs its course and it doesn't seem to be as effective as it used to be.
Yeah.
Or you just feel like, I'm in a really good place. I think it's time for me to have an engaging conversation with my physician and see if it's time for me to taper off and maybe.
Would that be 6 months minimum?
Well,
would you say,
I would tell you it's probably going to be longer. I mean, and the problem is when we come off of these medications too quickly, you get kind of almost a rebound effect. So you have to taper
Sure.
off of them very slowly. And even if we come up too soon, oftentimes you end up back on 3-4 months after you're off of it because you've rebounded back to the same situation.
Sure.
So when you look at it, at least in prescribing circles, pharmacy circles, we kind of look at people are on these things for the long haul. And I would say a year plus and maybe even longer yet,
I
depending
imagine
upon your tolerance.
It might even be the time of year.
It can be.
You'd probably rather go off in spring in Minnesota, Wisconsin. You know what I mean?
There are people that do benefit from short courses like that. So there's seasonal affective disorder.
Sure.
So I mean, and it depends on and there's lots of other ways that you can treat with that.
Go back on that time of year.
It can, and the holidays can be tough for people. COVID
Sure.
has not made it easy for people. So like we were
Right.
going back earlier, I mean, I'm just seeing a lot more of these drugs being prescribed for anxiety than ever before.
All right. How is these drugs stored? Are they stored any differently? Or?
Just a cool, dry place in the house. So basically, the worst two places storing a medication, if you're keeping score at home, guys, don't keep them in the kitchen. Don't keep them in the bathroom. Moisture destabilizes these medications rather quickly, and so. You spend good money on these medications. We want to make sure that they work for you. So,
Sure.
A bedroom, a drawer, away from out of reach of children, obviously. Want to make using your safety caps if you have small kids or pets around the house. So keep it high, like on a shelf or just somewhere where kids can't reach, or maybe even out of eyesight, but where you're going to remember to be able to get at it every day.
Can you become dependent on these drugs?
Not physically dependent, but there is,
you talked about tapering off.
Yeah, you taper off, but it's not like an addiction per se that you're going to be like you're shooting heroin and you need to get your next fix.
Yeah.
It's nothing like that.
Okay.
But if you skip a dose, your body, like we talked about a little bit earlier, your body lets you know. So there is a bit of a physical dependency just because your body is used to. And I always liken it when patients go, "Why does that happen?" It's kind of like if you were standing on a rug, Bob, and I just pulled the rug out from underneath your feet and you fell. That's an awful feeling. And it's much like the same thing clinically as when you accidentally skip a dose. your body lets you know it's a bad time, it's a bad day, and you definitely don't feel like it's effective, and things are going sideways on you.
Do you want to just talk about? We'll finish up with this. Maybe do you want to talk about some of the side effects
Yeah.
that are common that you see?
Yeah, and
Because they list a lot of
they
side
list
effects.
when if any consumer were to look at what I read on a daily basis, or what a physician reads on a daily basis, most people would probably be less inclined to take some
Right.
medications that they do. And a lot of the studies that are done, and I guess to compare like with the vaccines out in warp speed, I mean, we've done some really quick research. The research that went into these drugs is always ever evolving. Doctors are constantly publishing studies about what it's safe. Is it okay to use during pregnancy? Is it okay to use in pediatric patients? Is it okay long-term, short-term with certain different medications? So what we come back to, I'll circle back to side effects. And so it's like, what's best tolerated? Across the board, these drugs all have kind of the same side effect profile. And so it can be, usually it's GI is the first thing most people discover. So we want you to take it with food.
Again, short term.
Short term.
Yeah.
Although,
I mean, you should take it with food.
yeah,
each time.
I mean, and it is, but just sometimes it's just kind of a lot of the serotonin's in your gut, so it stimulates those receptors first, and so as a result, why you get tummy side effects. So food, then drug helps to eliminate that. So that's the primary one that I always discuss with patients. But kind of an odd one that happens in about 10% of the patients, almost across the board with these drugs particularly, is some people can actually get tired. So there's 1 in 10 that's just like, man, I am just dragging tail. And so you feel like, man, I need 5 cups of coffee just to get through my morning. And all of a sudden now I took 5 cups of coffee. Now I'm more anxious than ever. Well, that's not the way we want to go. So that 1 in 10, we actually want you to take at bedtime. So because for some of us, it's somewhat, you'll sleep through that side effect, and then by morning everything's right. You kind of get your dose patterns established, and it seems to work a little bit better. But for some people, that 90% of us that take these medications, you can get kind of an activating effect. And so it's not so much like you had a cup of coffee, but it's just got a little bit of a spark to kind of get you moving. And so it's something that obviously could interrupt sleep. And one of the side effects is, of course, insomnia. So we don't want to be promoting something that's going to keep you up all night when sleep is so paramount with actually treating anxiety. And that's, again, we could probably almost do another video on all non-drug things to use to treat anxiety.
Well, I think we'll cut it off there since we're at quite a long time here. And we'll pick up this topic with another video where we're actually going to tell you a drug you can take to kind of help you make it through that 4 to 6 week period.
Yep, there's a couple of them out there that definitely work in addition to this. And again, up to the doctor. But I think there's a lot of good things that we can do to help people with anxiety.
Thanks for watching.
Have a great day.